Also happy to be joined this afternoon by the Mayor of London, Ed Holder, the Acting Medical Officer of Health at the Middlesex-London Health Unit, Dr. Alex Summers, and the Chief Medical Officer at London Health Sciences Centre, Dr. Adam Dukelow. We're also happy to be joined by the media who are in attendance this afternoon. And just a quick reminder, if this is your first time or you haven't asked a question in a while, if you do have a question for Dr. Dukelow, Dr. Summers, or Mayor Holder, just click on the question mark inside the text bubble here on Microsoft Teams. And when you do, if you could indicate your name as well as your media outlet and who your question is for. And as we get underway, there are only a couple of questions in the queue. So I would suggest members of the media, if you do have questions, please don't wait to ask them. And finally, a welcome to those who are joining us this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, and those who are tuning in on the CTV London website. Let's get underway with our opening remarks. We'll start today, as we always do, with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. You know, despite case counts and hospitalization rates falling, despite restrictions being lifted and loosened, there are clearly increasing levels of frustration and animosity. Everyone's seen it, and too many have experienced it firsthand. I'll give you an example. I was speaking with my daughter about an incident this past week. She owns and operates a business here in town, and like thousands of others, she's required by law to enforce various mandates, including the requirement that customers be masked indoors. That's the law. In this instance, when she reminded the customer that she wasn't able to serve her unless she wore a mask, the woman indicated that she had a medical exemption. My daughter appropriately said, then can you please provide the medical exemption? Otherwise, I'm happy to give you a mask. My daughter was absolutely berated by this person who refused to wear a mask while inside her business. You know, even to the point where in her business, like so many others, my daughter would have come out to their car and helped try to serve them. They're in a small business. But this ignorant individual was loud, hostile, insulting, and rude. She put my daughter to tears. And it was ugly. And there's no call for that. This kind of shameless action is the kind of thing that people who don't support mask and vaccine mandates do themselves a disservice. Rather than trying getting people on their side, maybe that's not their objective. Maybe their objective is simply to be loud, hostile, insulting, and rude. And that's a shame. But if they are looking to get people to be more empathetic to their perspective, they need to show that same empathy. I share this because I'm somewhat anxious about what might happen a week from today when proof of vaccination is no longer required at various establishments. Look, some businesses may choose to drop it, others may choose to keep it. And you may agree or you might disagree with their choices. But surely, regardless of that opinion, we can all remain kind and decent and respectful towards one another. For all the talk lately about freedom, if you disagree with about how a business is operating and how they operate, you have the freedom to go elsewhere. If you have the freedom to tell friends and family how you feel. You even have the freedom to state your case politely to those who make the decision. But remember this, businesses and employees are doing their best, and they're following the law. Everyone is doing what they can to get by. This is simply an appeal for calm and for patience and, you know, for basic human decency. And so when I think of my daughter and the debacle and the sad situation she went through this past week, you know, I feel badly for her, but I really feel sorry for the protesters and those who frankly don't get it, probably never will. And that's unfortunate because my daughter will get over that, use that as a learning experience, as will those who in retail have had to deal with that for so long. and she'll grow from it. People like this don't know how. But I hope all of us will keep that in mind as we move to the next phase of our reopening a week from today. That's all I got for now. So over to you, Dr. Summers, please.
Thank you, Mayor Holder, and good afternoon, everyone. We are reporting 29 new cases today, with 190 reported over the weekend. we continue to see a decline in the case counts that we are reporting, always qualifying that piece of information with the fact that it underrepresents the total amount of COVID activity in our community due to the limited number of people who are eligible for testing. However, the trends remain clear. Case counts are declining, as are hospitalizations, generally speaking, across the province, although there are some regions in the north where rates have plateaued and are going up slightly. All this being said, the risk of Omicron in our community remains high. We continue to see substantial transmission. We continue to see significant impacts from COVID-19 in our community. The ongoing push to vaccinate remains absolutely critical. And for those in our community who've not yet received a first or second dose, or if you have not yet received a booster dose, it's still not too late. Your protection for yourself from a booster is not just significant against Omicron, but will be important for any new variant that comes down the line. Yesterday at the health unit, we celebrated Superhero Day at all of our vaccination clinics, and we saw an increase with 648 doses delivered yesterday. And we were delighted to see all of those friendly and smiling and enthusiastic faces at our clinics yesterday. Thanks to our community for supporting that. Our vaccination clinics remain open. They remain easy to access. Walk-in appointments are available for people of all ages. On Friday, 12 to 17-year-olds became eligible for a booster dose. You can make that appointment at any time at covidvaccinelm.ca, or of course, walk in to any of our mass vaccination clinics or community clinics. We've seen gradual increase in vaccination coverage week over week, but it has slowed. And so if you've not yet had the opportunity or taken the opportunity to get your booster or to get your first or second dose, please do so. As we see public health protections scaled back, the benefit of getting vaccinated only increases. Our pathway out of public health protections is through vaccination and is through the ongoing care that we show for one another when we decide to get vaccinated or when we decide to continue to wear our masks and follow all those critical public health protections that remain in place. For this week, proof of vaccination is still required at a majority of settings. Make sure that you continue to abide by those rules, as they are important for protecting you and those around you. And next week, March 1st, when that becomes optional, I still strongly encourage proof of vaccination to be considered by businesses and for individuals who've not yet to get vaccinated to still go and get vaccinated. We will still see the requirements for vaccination from travel, I imagine, but most notably, the impact of that booster is amazing when it comes to protecting you from hospitalization and death, even against Omicron. So we celebrate Superhero Day each and every day, but most notably we did yesterday. And I still encourage you strongly to get out, to get vaccinated, and continue to take care of one another like we have for over 2 years now. With that, I'm going to pass things over to Dr. Dukelow from London Health Sciences Centre.
Good afternoon. Thank you, Dan, Mayor Holder, and Dr. Summers. I appreciate being here to share an update on COVID-19 at London Health Sciences Centre. As of this morning, we're caring for 64 COVID patients, our positive inpatients, and we have 9 in critical care. In our children's hospital, there are 7 inpatients with COVID and fewer than 5 in our pediatric critical care. We currently have 4 units which are on outbreak, one of which was just declared yesterday. While we do everything we can to control, mitigate, and prevent outbreaks from happening, this is an important reminder that while we may be seeing restrictions loosening in our community, COVID-19 is certainly not over in the hospitals, and as Dr. Summers just mentioned, it continues to circulate in the City of London and surrounding communities. On that note, I'd like to reiterate that at this time, LHC will continue to maintain our vaccination requirements for both staff as well as non-essential care partners. We will continue to require that both staff and non-essential care partners adhere to the province's definition of fully vaccinated by showing proof of 2 doses of Health Canada approved COVID-19 vaccinations. As a care provider, it is our responsibility to ensure that our hospital remains as safe as possible for our staff and the vulnerable patient populations who have no choice but to be here. We take this responsibility very seriously. Given the populations that frequent our hospital, we are a more high-risk setting than other places such as a shopping mall or restaurant, and therefore believe this extra layer of protection is necessary within our facilities. The science is clear. COVID-19 vaccines are safe and effective. We ask that our community continues to join us in following public health guidelines, getting vaccinated, including that third dose or booster that Dr. Summers was speaking of, physically distance, mask, and practice proper hand hygiene. Thank you again. I look forward to your questions.
Thank you very much, Dr. Dukelow, Dr. Summers, and Mayor Holder. Well, we do have a few questions in the queue. And again, a reminder to our media partners who are joining us this afternoon to not wait for submitting those questions this afternoon, as we only do have a few in the queue. So the sooner you could get those questions in, the better. So let's go to those questions right now. And the first question is for Dr. Summers and for Mayor Holder. And here's what Jane is asking. She says, I wanted both of you to weigh in on how some institutions, such as hospitals and post-secondary institutions, won't be dropping their vaccination policies anytime soon. And we heard Dr. Dukelow mentioning that just a few moments ago. Are there other places that you expect would or should follow the same policy? Just going to see who would like to take this one on first. Mayor Holder?
Sure, thanks very much, and thanks, Jane. Look, you can imagine why hospitals and those involved with dealing with large groups of people, institutions like post-secondary institutions, would not want to drop their vaccination policies at this point. Look, as has been cited, we're still very much in the middle of this pandemic. The fact that we are seeing some loosening of restrictions does not mean that this pandemic is over, not by any means. So, in the interests of absolute caution and extreme care, you'll see, I think, other institutions choose to do this as well. And I think it's ultimately a matter of time as we wrestle Omicron and the COVID-19 pandemic to a more manageable level, that as we do that, then you'll see, I think, restrictions loosened. But I applaud those who, frankly, have maintained those requirements in terms of vax policies. And as we all know, masking is still an absolutely required. So the province, I think, has made it clear, though, that they're going to allow major institutions and all institutions, effectively businesses included, to make their own call on this. And I think businesses, for the sake of their clientele, will ultimately do the right thing.
Thank you, Mayor Holder. Dr. Summers.
Thanks for that question, Jane. I strongly support the ongoing use of proof of vaccination policies, both for employees and for patrons, clients, or visitors, certainly in settings like hospitals and post-secondary institutions, but any setting where people gather or are working in close proximity will benefit with regards to COVID-19 by ensuring high vaccination coverage. And so certainly, especially during this peak of continued ongoing Omicron transmission in our community, these policies, I think, particularly ones that support and encourage third dose and booster dose uptake, are to be applauded.
Thank you very much, Dr. Summers. Let's go to the next question, and it's a follow-up from Jane Sims. Mayor Holder, this one is for you. Jane asks, Mayor Holder, has there been any upswing in problems with compliance for bylaw officers since the blockades in Ottawa, Windsor, and along Highway 402?
Jane, I don't think there's been a particular upswing in problems with compliance. I've always argued the right for peaceful protest. And I think what you've seen in London in the main, be they convoys or be they people coming together, this is certainly in the last while, that they've come together peacefully and they've left peaceably. So I think from that standpoint, we haven't seen things that are particularly dramatic. I think what's fair to say, we are seeing some small offshoots, small protests here and there from some who may protest by a corner and have signs up. But you've also seen some anti-protester crowds come together to protest the protesters, as it were. I think it's fair to say a couple of weeks ago we saw that here in London. I'm not imagining as a result of the changes and the takedown of the blockades, both in Ottawa and Windsor, that we're going to see additional problems because of this. I think the protesters, by and large, have made their point, and I want to remind folks too. This is not, as how some have suggested, half of Canada thinking this way versus another. Here we've got like 90+% in London, Ontario, vaxxed. They get it. And so we have a small percentage who will never be convinced. And regardless of how hard Dr. Summers pushes and Dr. Dukelow promotes and Ed Holder badgers and pushes, the fact is there are those, come hell or high water, will not do it. They just won't get vaxxed. They'll try not to wear their masks where they don't have to. And they will have some of their privileges limited, at least for this period of time. So be it. And it's not going to matter. I've said time and again that what you have is the greatest majority of people, particularly in London, but across this country, that are doing the heavy lifting for those who won't even do the bare minimum. And it's the bare minimum, folks, that very small group that we give far too much attention to for the noise that they make. And I wish we wouldn't give them the kind of attention, because frankly, they're not worthy.
Thank you very much, Mayor Holder. Let's go to our next question. It's from Jacqueline LaBelle at Global News Radio 980 CFPL. Dr. Summers, Jacqueline asks, are you able to provide more information about the 4 deaths that were reported on Saturday?
Thanks, Jacqueline. 3 of the deaths that we are reporting were amongst individuals over the ages of 80 who had been vaccinated, including a booster. One of those individuals was in their 50s and was unvaccinated. Some of the deaths being reported today were reported after a data review, and the reporting of those deaths today don't necessarily provide an indication of when those deaths occurred. We are consistently seeing that deaths are happening amongst older individuals, some of whom have been vaccinated and some of whom have been boosted. In those instances, often there are significant other complications leading and impacting those deaths. For individuals under the ages of 80 or under the ages of 70, we are not seeing COVID deaths unless you are unvaccinated. The protection provided by that vaccine across the age brackets remains significant, particularly for those in that 40 to 70-year-old age bracket.
Thank you very much, Dr. Summers. And a final call for questions. If you have any to ask, now would be the time to get them in as we head into what is currently the last question in today's media briefing. And it comes to us from Calvi Leon at the London Free Press. And this is a question for Dr. Summers. Dr. Summers, do you expect that many places may still ask for proof of vaccination despite the requirement being lifted on March 1st? I know you talked a little bit about this before. I wonder if you have any additional thoughts on that one.
Thanks for your question, Calvi. I don't know how many places will voluntarily continue to ask for proof of vaccination. Again, I would strongly support any organization that continues to do so.
Thank you very much, Dr. Summers. That does bring us to the end of our questions for this afternoon's virtual media briefing. We thank you for joining us, and we also thank Dr. Summers, Dr. Dukelow, and Mayor Holder for their time, information, and insights this afternoon. We will be back with our next virtual media briefing. That is coming up Thursday, the 24th of February at 2 p.m. We hope you'll join us. So between now and Thursday afternoon, have a great rest of your Tuesday, and so long for now.